The dexamethasone suppression test is a blood test that assesses adrenal gland function by measuring how cortisol levels change in response to an injection of dexamethasone. It is typically used to diagnose Cushing syndrome. It may also play a role in diagnosing depression, but this application is still considered experimental. Physiology: dexamethasone is an exogenous steroid that provides negative feedback to the pituitary to suppress the secretion of ACTH. Specifically, dexamethasone binds to glucocorticoid receptors in the pituitary gland, which lies outside the blood-brain barrier, resulting in regulatory modulation. Interpretation: low-dose and high-dose variations of the test exist. The test is given at low and high doses of dexamethasone and the levels of cortisol are measured to obtain the results. A low-dose dexamethasone suppresses cortisol in individuals with no pathology in endogenous cortisol production. A high-dose dexamethasone exerts negative feedback on pituitary ACTH-producing cells but not on ectopic ACTH-producing cells or adrenal adenoma. Low dose: a normal result is a decrease in cortisol levels upon administration of low-dose dexamethasone. Results indicative of Cushing's disease involve no change in cortisol on low-dose dexamethasone, but inhibition of cortisol on high-dose dexamethasone. If the cortisol levels are unchanged by low and high-dose dexamethasone, then other causes of Cushing syndrome must be considered with further workup necessary. High dose: after the high-dose dexamethasone, it may be possible to make further interpretations. A EuroACTH is measured prior to dosing of dexamethasone. Equivocal results should be followed by a CRH stimulation test, with inferior petrosal sinus sampling. References: Theodore C. Friedman, M.D., Ph.D. Professor of Medicine, UCLA Chairman, Department of Internal Medicine, Charles Udry University. http://www.goodhumanhealth.com Cushing's Magic 13 ppt.